talk about saving bone, and it also kind of ties into the fear of patients. You know, when things start going bad dentally and you don't feel good about yourself, it kind of becomes a snowball. It kind of becomes the boogeyman under the bed. One patient that I know, we all cried when we finished her case. She was actually the daughter of a dentist. And her father passed away many years ago, and so she didn't have a dentist. She was also a heavy smoker. And so as things got worse and gum disease started taking effect, she basically withdrew. She took a lot of courage for her to call us and make an appointment. In fact, when she came into my office, she couldn't sit in the dental chair proper. She had to sit side saddle, and I just sat it, and we just talked and asked her what brought her to our office. And, you know, we had this long conversation, and she just broke down crying. You know, and you could see the pain and the fear and how much it took for her to get in there. And, you know, we gave her a very honest opinion of what was needed and how we would sequence it and what kind of time frames we could do. And her goal was her son was getting married. So I had a year. And she worked with me, and we got everything together. We staged it so that she was never without teeth, so that when we had to take out certain teeth, she had a temporary partial to cover those teeth. And when we had to take out the rest of her teeth, she had immediate denture and bridge work so that she walked out with a full set of smile. On the day of surgery and the removal of her teeth, she cried and went around smiling all over the place. And for a month, she just couldn't get over it. And I go, you know, this is great, but it's going to be better. It was. When we got to the final end of the case, 2 weeks before, we put everything in, and she looked 20 years younger, and we all hugged and cried. I'm getting a little misty just talking about it.